What does an elevated IRT mean in CF newborn screening? Imagine a tiny baby just a few days old, and a simple blood test can give important clues about their health. One of these clues is the level of a protein called immunoreactive trypsinogen, or IRT. When IRT levels are higher than normal in a newborn, it can be an early sign of cystic fibrosis, but it's not a definite diagnosis on its own. Instead, it's a warning flag that prompts further testing. IRT is a protein made by the pancreas, an organ that helps digest food. In babies with cystic fibrosis, the pancreatic ducts are often partially blocked because of the disease. This blockage causes enzymes like trypsinogen to leak into the bloodstream, which raises the IRT level. So, if a newborn has an elevated IRT, it suggests there might be an issue with the pancreas, possibly cystic fibrosis. This test is part of routine newborn screening because it is very sensitive. That means it can detect most cases of CF early on. But it's not specific enough to confirm the diagnosis because other factors can also cause high IRT levels. For example, premature babies, babies who had a stressful birth, or even contamination of the blood sample with meconium, the baby's first stool, can all lead to elevated IRT. Sometimes, a baby might have a high IRT without having cystic fibrosis. When an elevated IRT is found, the next step is usually genetic testing. This involves checking 4 common mutations in the CFTR gene, which is responsible for cystic fibrosis. If one or more mutations are identified, doctors will often perform a sweat chloride test, which measures the amount of salt in the sweat. High salt levels in the sweat are a hallmark of cystic fibrosis and help confirm the diagnosis. It's important to remember that not all babies with high IRT have cystic fibrosis. Some may only carry one mutation, meaning they are carriers and do not have the disease. Others might have no mutations found, which makes CF less likely but doesn't completely rule it out because genetic tests don't cover every possible mutation. Because the IRT test can sometimes give false positives or negatives, many screening programs include a second IRT measurement or combine it with genetic testing to improve accuracy. This way, healthcare providers can better identify babies who need further evaluation. In the end, an elevated IRT is a helpful early indicator that a baby might have cystic fibrosis, but it's just the first step. It triggers additional testing and close follow-up to confirm or rule out the disease. Early diagnosis is crucial because it allows for timely treatment and management, which can significantly improve a child's health and quality of life. If your baby's screening shows an elevated IRT, it's important to work with healthcare professionals who can guide you through the next steps and provide personalized care.